Okay, so welcome to RSI Help. As promised, we're going to be talking with Dr. Nick Wisniak, and this time he's going to tell us about rotator cuff injuries, which are a very common thing with people with RSI. So, Dr. Nick, can you just plunge right in and tell us about how they happen?
Yep. So key thing for us to understand, rotator cuff injuries happen when the small muscles that make a cuff around your shoulder, around your glenohumeral joint, actually get torn or damaged. And people will hear, oh, muscles get torn. This is what happens when fibers get injured, is they get torn. The name rotator cuff comes from, I didn't just lose my hand, the name rotator cuff comes from the cuff shape they make around the head of the humerus. And so you can have little tears on the front side, the superior side are the most common, sometimes on the back or inferior, pretty rare, but those are your main issues for rotator cuff tears. All right. The injuries occur secondary to repetitive loading or excessive loading, or if there's an underlying condition of instability or arthritis or anything else that makes the joint a little bit looser.
And so what kind of movements would lead to this? Common movements that people may not think of.
Yeah, absolutely. So a common movement would be something, a prior injury to a shoulder where it has been dislocated. If an arm is forced way back into extension and really forced back into this position and you hit the elbow like this, the shoulder joint becomes unstable towards the front. The same thing if you go the opposite direction and you push the shoulder joint back, it becomes unstable as well. So those are movements. Also, one that it's in the literature quite a bit, even if you do lifting to here is okay, but this last little bit of lift all the way up like this puts a lot of pressure over top of the shoulder joint, winds up grinding some of the surfaces inside of it that you don't want to do. So you're trying to avoid those types of actions.
That's really good cue for people who do weightlifting, because a lot of times you will see them doing things. And this is not related to bicipital tendinitis, but you were talking earlier about overhead movements, and a lot of people, because they can't get their arms up, they do what they think are lat pull downs like that, and it's not the lats that you're working at that.
No, absolutely not. In fact, you're probably causing more damage than benefit. Even though you're technically moving, the way that you're moving is actually injuring your body. Usually what we recommend for most of the activities we talked about before with the YTWs, but even something more simple than that would be just having somebody hang with their arm and swinging it around from side to side. This movement right here, it's called a Codman's arm swing for physical therapists who use it. And when you're moving your arm around like this, it just initiates some of the rotator cuff muscle actions, starts to put synovial fluid spreading throughout the joint and warms it up a little bit better. If you find yourself unable to do the range of motion for a specific exercise, you need to work on your flexibility and figure out why you can't do that rather than trying to force yourself into these weird positions that ultimately lead to more injury.
I was going to talk to you, actually, you're begging the next question that I was going to ask you, which is about muscle balance. Because so often people will be tight here and weak in the back, and they don't seem to connect with the need for muscles being balanced.
I treat a number of bodybuilders, and some of them don't even train the front of their body because our society is so anterior front body dominant. If you look at most people, how do they spend their day? They're hunched over like this, so it means all of the structures on the front of the shoulder wind up going into a shortened position, and they become tight in that position, so it makes it harder for you to even open up. Anybody who's watching this right now, I would challenge you to go from this to bring your shoulders back, put your chest out, and tuck your chin back, and take a breath in there, and see how much better you feel. This is something we call an upper cross syndrome. Now, usually we talk about it around the neck, but it has the same effects around the shoulder when the person is leaning forward and in like this. And it's there, the longer you spend in that posture, the more likely your body is to get shortened in that posture because you're just stuck in this position, so you want to stretch out of it whenever you can.
One of the things that I tell a lot of the male clients that I've had is that if you want to look bigger, stand up straight and do the posture you just showed, widen your shoulders, and instantly it looks like you've got, a nice chest.
Totally.
So, doing all of these.
It's not just, yeah. So you see that exactly. So the bodybuilders, they do what I call a mirror lifting. Okay, they're mirror trainers. If I can see it in the mirror, then I work it.
Yeah.
If I don't see it in the mirror, well, then we don't work it that much, right? So
Yeah.
the key thing for that is absolutely right. It's not only men, it's for women as well. Ultimately, if you stand with your shoulders back and in a relaxed position, this is a more attractive position to be in. People will respond better to your body language because of the way you're actually standing. And a major player for that is the positioning of your shoulders. If you come in to see somebody, or you're going in for a job interview or something like this, and you walked in like this, how well do you think it goes versus if you walk in with your shoulders back in a more neutral position? This is the picture of health, right?
Exactly, exactly. So I think that one of the ways, it sounds from what you're saying, Dr. Nick, we can prevent problems with bicipital tendinitis by doing I's, T's, and Y's, or W's as you call them.
Yep.
And just these small, and I think we call these pendulums, this swinging of the arm,
Yep.
you know, sort of a mild, sort of nothing circle of the arm in a semi-tilted position.
That's it. People think it's nothing, but it actually is the starting of initiation of warming up the tissue for more aggressive activities. And you definitely want to warm up.
Nothing is a lot. It's sometimes a hard concept to get over to people, that these little things that we do can be such lifesavers.
Yep, absolutely.
But anyway, thank you so much for sharing your knowledge about bicipital tendinitis. Thank you all for watching RSI Help YouTube. Be sure to stay tuned, because next we're going to be talking with Dr. Vizniak about glenohumeral problems. So stay tuned.
All right.